So the Survivors Access to Supportive Care Act, this is legislation that I have joined with Senator Murray of Washington State to introduce. It is designed to address, I think, the real failure that we have when an individual has been the victim of sexual assault. We know in Alaska, we unfortunately have some of the highest sexual assault rates in the country. We know that around the country, American Indians and Alaska Native women, 2 out of 3 are victims of rape or sexual assault. Oftentimes, we have a situation where the survivor of a sexual assault is not able to achieve any level of justice against the perpetrator because they have not been able to gather the evidence after the assault. And sometimes it's lack of a rape kit, but more often than not, it is lack of a trained individual that can help collect that forensic evidence. So what we're doing with our legislation is to provide for training, specifically for us in Alaska and in rural parts of the state where we don't have hospitals, but we do have clinics, for our community health aides, for our community health practitioners to be able to be trained to be what they call sane nurses, so that they can help administer and collect this important evidence so that prosecution can go forward, so that justice can be had. These are some of the very preliminary steps that need to be put in place. Our reality is that we do not have the trained professionals, either in our clinics or in our hospitals, to meet this unfortunate need. And so this is an effort that will help us in Alaska, but it will help us around the country in ensuring that the proper training is had, so that those who are the survivors have an opportunity to seek redress and to get the justice that they deserve.